Welcome back. Let's continue normalizing these conversations and education about death and dying so we die better at end of life. I'm Abigail. Today we're going to talk about things that may not be covered under the hospice insurance benefit. Should be very few, but it's worth mentioning, and we're going to cover that today. So if you watched my other video of why you shouldn't die without hospice, I go over many amazing things and benefits that come with hospice care that are just really, I think, wonderful, incredible. They're just really wonderful and incredible benefits of which the general population is just not aware. So this is why we do this whole thing, right? This whole spiel. But I want to talk about in the rare instances, and they should be quite rare, where there may be certain things under your hospice insurance that you may need to either pay out of pocket or it may not be covered or may not be covered by hospice care. Now, in the video where I talk about why you should not die without hospice, I go over what is covered in hospice. I'm going to go over that again, just kind of generally, in case you haven't had a chance to review that video. So under hospice care, you have an entire, medical team of nursing care, nursing aid care, counselor care, medical social worker, spiritual care counselor. Listen to my spiel on that because people sometimes get freaked out about all these titles, and I need to dispel those types of things. Maybe I'll do a separate video just on that. But you not only get all those incredible disciplines that are so skilled at end-of-life care and so necessary at this time, but you get a medical doctor that also works with a nurse practitioner or a PA. And, these people come to your home. So they come to wherever your home is, whether that's at a private home or a residential care facility or a skilled nursing facility or at a hospital on the rare occasions that you are on hospice in the hospital. And so you have these people that actually come to you. And not only that, if you have an emergency, if say the person who is on hospice, your loved one or yourself, if there's a fall or if they, start to have a seizure out of the blue, or if they start to develop, any type of symptom that kind of comes out of the blue and needs medical attention right away, like, problems with breathing, shortness of breath, if they all of a sudden become really anxious, if they start yelling, if they start having pain, so many different things can happen. And what you do in those cases, instead of going to the emergency room, again, talk to your hospice team. If you are a do not resuscitate, you're not going to the emergency room, but sometimes people have different directives. But talk to your hospice team about that. But usually you're not going to the emergency room. Most cases you're not. The hospice team will come to you. And the hospice team can provide the medical care in the home, wherever that home is, and prevent an unnecessary futile trip to the emergency room. So, you don't have to waste your time, you don't have to waste your money or anything like that. So that is a really, really wonderful thing. And then you get stuff. It's like getting free stuff, right? You get your medical equipment, your bed, your wheelchair, your bedside table, your recliner chair, oxygen. You can get a bedside commode. You can get your stuff that you need for the wound care. If there's a wound, if there are tubes and stuff that are attached to the person or in the person, you can get stuff for that. Obviously, if it's things like certain clinic that require clinical skills to like drain a drain or something like that. That's very specific. The hospice team will actually do that for you, or they can teach you if it's something they can teach you to do at the home, depending on how often something needs to be drained, for example, or changed, whatever. But the equipment for all that stuff, if it's related to hospice, will be covered by hospice. And the other thing is too, and I failed to mention this at the beginning, in terms of hospice staff, you also have things like hospice volunteers that come and do these other special things. Hospice staff can be trained in healing touch, aromatherapy, things like that. The volunteers can also be trained in that, but they can also be trained in things like pet therapy, art therapy, music therapy. They can bring you a burger from your favorite burger place. Anything else. I mean, there's so many things that the hospice volunteers can do, hypnosis, things like that. So you have an incredible amount of things that are offered to you by hospice. So you can look at that video, watch that video if you want more details, but I gave you a very, very quick rundown. The video just goes into a little bit more specifics if you care to learn more about that. There are cases, and they should be rare, where hospice may not cover something. The insurance that covers hospice will not cover certain things. And that's what we're talking about today. I need to emphasize these cases should be very rare. They should be few and far between. Hospice over time has been required to cover more and more things related to end-of-life care. Hospice in general should be covering anything and everything related to end-of-life care medically, okay? Now, there can be little perks to it, like with the volunteer staff. They can, like I said, bring you a burger, take you to get tickets to go to a certain thing, whatever it may be. But the hospice care covered under insurance and the medical care should all be basically free of charge. You should not be paying anything out of pocket, okay? Remember, you kind of paid for this already with taxes, but for Medicare, Medicaid, things like that. But that's a side note. You shouldn't be getting much things that are required to be paid out of pocket when you or your loved one, is receiving hospice care. So anything that's medically, any part of your medical care should all be covered. What may not be covered are certain things like really highly specialty items, things that are kind of considered more luxurious. So a good example of this is if you really, you're given a medical bed by your hospice insurance company and care company, and you're kind of like, I just really like this other bed that I was looking at online. It's a little fancier. It's got more bells and whistles, and maybe it has a heating pad. It's got all these other fancy things that, that I like. And, I just want something more than just a basic medical bed that, can do a lot of things already. Basic medical bed can have a specialty mattress, to protect skin. It can move the head of the bed up and down, the foot up and down. But if you want something like extra special, that's kind of a real specialty luxury item. I say luxury because I just kind of want to emphasize that it's like fancier. It's kind of I'm trying to emphasize that it's just maybe a little fancier than the normal hospital bed. And maybe it has a different color. Maybe, like I said, it has all these bells and whistles. If Medicare is already providing you, or the hospice company is already providing you a medical bed, an essential medical bed with the basics that are, needed for a medical bed, and you want something fancier because you just have a preference for all those bells and whistles, that probably is not going to be covered by the hospice insurance plan. And if you really want that, then you'd have to pay out of pocket, or, find a site that sells them at a discount, or maybe, get something that's donated from somebody else from that had used it before. So something like that. Same thing with a wheelchair. If you have a wheelchair already, that's already provided by the hospice company, and it does what it needs to do. It does that function of moving the patient, transporting the patient around the home, or taking the patient outside. Then you've got what you need. Those are the essentials that are met. But if you want something that is, say, a motorized wheelchair, and just because it makes it easier, for you, or it's just something that's maybe a preference, that may need to come out of pocket. Now, there have been occasions where motorized wheelchairs have been covered. I've seen that. And, again, you just have to, the hospice company has to just explain to you why things may not be covered. So I'm going to talk about that at the end as to what you do when they tell you that something is not covered, okay? Other things that may not be covered. If you say, like, you or your loved one, whoever's on hospice, has a particular wound, maybe, some like a wound, and the hospice is providing the appropriate medically needed wound care supplies for that wound, appropriate dressing, cleansing materials, things like that. And you say, well, there was this dressing that they were using in the hospital that I just really liked. But if the hospice is able to provide something that medically treats that wound appropriately, and what's deemed appropriate and safe and according to medical practice, then they're not necessarily required to give you the wound dressing just because you liked it better, because it was maybe more fluffy or cushiony or whatever. If the wound care supplies that the hospice is providing the appropriate medical care for that wound, then they're doing the essential stuff, they're doing the appropriate stuff. The other fancy stuff you may need to pay out of pocket for if it's something you really, really want. This is more tricky because, when we get to wound care, there's so many things that you can do, and there's so many things out there. And what we want to do in hospice care is not necessarily expect the wound to heal. We have to remember that in hospice care, we're not expecting things to necessarily, fix themselves. We're not expecting the wound necessarily to close up because, you're lacking the reserves. A body that's dying is lacking the reserves and the resources to actually heal a wound. So what we really want to make sure in hospice care, at end-of-life care when someone is dying, is to make sure that wound doesn't get bigger. We want to make sure that wound doesn't cause any discomfort. What will likely happen is that the wound will get bigger because I want to make sure you get this context. We're dealing with someone who is dying. So it's really critical that you understand this. And I will get into this in another video. So that could be another case. Now, what's also not sometimes covered in hospice care is certain amounts maybe of things like tube feeding or IV types of feeding in the veins. So depending on the case-by-case scenario, the hospice may say, we're not covering the tube feeding because we don't usually cover the food, that someone gets. Hospice doesn't cover food, they cover the medical care around hospice. But I have seen more and more, and appropriately so, where, you can cover maybe a certain amount of tube feeding that is provided to the person to prevent them from getting hungry. Okay, you may say, well, how do you know if the person's getting hungry? Well, what you can do is basically calculate a basal metabolic rate and base number of calories that person may need to help maintain, them and keep them comfortable, for example. But, if you're used to, say, having your loved one be on 24-hour tube feeding, at end of life, you have to really think about the efficacy there. Because at end of life, we take this into the context of a dying body. A dying body, remember, cannot utilize everything appropriately. So what will happen is you'll start having side effects more and more. And so something like a continuous, around the clock or even 8 hours a day, whatever it may be, tube feeding is going to possibly cause more side effects, more issues than benefits, where the person is at risk of aspirating because they can't digest it quickly enough. So what happens is it starts to come back up and it can get into the lungs and cause pneumonia, things like that. So very serious types of things with that. So really what hospice should be doing with you is talking to you about your goals of care, talking about what's the comfort for the patient and the best interest of the patient, and go from there. Other types of things that may not be covered, typically are, things like certain equipment and medications. So certain medications that are not efficacious in a very quick amount of time usually aren't really make sense and usually aren't covered for good reason. Very popular one, probably one of the more popular ones that I've seen in my experience, particularly in people who have kidney failure or any kind of kidney issues, are things like the EPO injections, and to help the red blood cell count. And so the one thing I need to emphasize there is, in order for these injections to work, they work over a period of 4 to 6 months. And, when we're talking about someone who's on hospice and who's dying, remember, someone who's dying doesn't have all the resources to actually utilize the medications appropriately, but also if a medication is going to take literally months to get the desired, result, which is more red blood cells, if you can even get that at that point, in a person that's dying, it's not going to make sense for someone who literally has days, weeks, months to live, right? So using a medication like that is just another medication, and it really has no efficacy there at end of life. There are some other medications that may not be covered. So things like if you or your loved one is taking oral chemotherapy, again, we're really talking about what is the chemotherapy treating and how is it actually treating the comfort, right? Because in hospice care, we're looking at comfort care. What is benefiting the comfort of this person right now? And at end of life, chemotherapy typically is not. More than anything, it's causing side effects, nausea, vomiting, mouth sores, a multitude of other things, right? Because the chemotherapy actually kills off the very fast-growing cells. So sometimes, doctors, oncologists may say, this chemotherapy or this radiation, these other treatments, I'm talking about medications right now, but I'll kind of clump medications and other medical treatments together. Radiation is going to help shrink the tumor. I need you to understand that in order to shrink the tumor, you have to be able to shrink the tumor. At an end of life, again, that may be unrealistic. Now, I know I'm not a physician, so I understand that there are cases where I'm a nurse. I'm going to work within my scope of hospice care. But what I need people to understand here is when a physician tells you this, that this is palliative radiation, this is palliative chemo, I need you to ask them specifically what they expect to see happen in order for this radiation or chemotherapy to be palliative. How is this actually helping with the comfort? And if you're expecting a decrease in that brain tumor, how much of a decrease do we expect? And what is that going to do? Does that mean that the person's going to remain awake longer? Does it mean that the person won't have headaches? Does it mean that the person won't have a seizure? Does it mean that person won't have confusion? What specifically does it mean? And I know it depends, there's so many diagnoses and things to cover, I always feel, in all these, but I need to give you kind of the basics here. So when someone tells you this, particularly for chemo and radiation, that it's palliative, you need to ask specifics and have your hospice team help you. Because most of the time, in order to get any kind of relief of these symptoms, you have to really significantly decrease the size of the tumor, of the metastases. You can treat the comfort of these through other medical interventions using things like, don't assume that I'm just going to say morphine, but things like, prednisone, or things that decrease the inflammation, the swelling around all these sites, the metastases, the tumors and things like that. And there's so many other things that we can do, using NSAIDs in conjunction with narcotics. Basically, using a Tylenol in conjunction with, morphine or things like that, and something for anxiety. There's so many things that you can do, and you don't have to, get somebody completely sedated with medication. So you need to, again, ask and seek the understanding and use your hospice team to help you out. Use the hospice physician, the nurse practitioner, PA, RN case manager, have them help you out here. Other things that may not be covered by hospice are certain medical appointments. So if you are in medical types of other interventions, so if you're going to see a doctor that is, say for something that's not really related to end of life care. So say you want to go see your oncologist again, and that oncologist is not your attending physician. They're just someone that you've been seeing while you were treated curatively for cancer, you were getting your palliative radiation chemo. You need to make sure that you talk to your hospice team before you see these other types of, practitioners. Things like if you go and see a chiropractor, or you go and see a dentist, or you go and see an eye doctor, or you go and see, someone for massage therapy, or you go and see somebody for IV fluid therapy, something like that. You need to talk to your hospice team. If you are expecting that to be covered, you need to be talking to them before you go see them. Other types of medical care, say you want to go and get a big blood panel done because you're curious to see what the red blood cell count is for your mom and see if it's time to get a blood transfusion. Again, that may not be covered because a blood transfusion is usually considered curative. On occasion, when someone is having real issues that need treatment for palliation, maybe a little fluid therapy, but not usually blood transfusion, because you can treat the symptoms of those issues where you're lacking, blood volume, or you're lacking red blood cells with things to help manage shortness of breath. So you can manage shortness of breath, yes, with some breathing treatments to open up the airways, a little touch of morphine. You don't just snow that person, just a little touch of morphine to open up the blood vessels, lower the diaphragm to expand the rib cage, things like that. Morphine is a really critical thing to understand, that there's so many benefits to that. And so there is a video already posted in my channel if you care to learn more about that. So those things, again, may not be covered because, again, it's not really related strictly to comfort care, and it's not really And it can be treated with all these other medical interventions that can be done in the home by the hospice team. Okay. So again, hospice insurance is really looking at providing all the care in the home, minimizing hospitalizations and these other fetal treatments that are basically not really going to show promise. So Medicare, Medicaid, the insurance company that is providing hospice care is expecting hospice to continue and be very faithful to providing strictly comfort care and comfort-focused care. Hospice care will still treat aggressively and still manage care aggressively, but hospice care is not curative care. So you're not going to be doing the typical types of curative measures like a reparative surgery for a fracture that can be managed in the home, chemotherapy, radiation to try to stop the cancer from growing or try to cure the cancer, things like that. There are certain many other medications. Certainly if you have questions about them, put them here. But the best thing to do is you always talk to your hospice team about what's covered, not covered. Hospitalizations, typically those, it can be a little bit complicated, but if you panic and say you call 911, and you're like, oh, I meant to call hospice. Oh, call hospice right away. Let them know you accidentally called 911, and they can work with you, especially if you have like your pulse in the home. That'll be covered in another video. If you have your pulse in the home or your paperwork that says what kind of decision making you want, at end of life or medical decisions, things like that, hospice can work with you on that. But typically, if you just want to go to the hospital just because maybe you don't have the right caregiving at home situated, and you just decide, oh, I'm just going to send mom to the hospital, that kind of stuff is not going to be cared for because, you have to work with your hospice team on if there are concerns about proper care in the home, things like that. Work with them. Make sure that if you feel like you want to go see a certain other specialty or another doctor outside of hospice or go to the hospital, that you contact hospice first. Okay. Hospice, when you contact them, should tell you and explain to you what's covered, what's not covered. And if they say that something is not covered, ask them for something in writing, if they provide it. Make sure that you really understand why. And again, I'm going to bring in the dissonance here because this is a critical thing. I talk about dissonance in another video, but where, we have this dissonance between, our brain and our heart. Make sure you understand the reasons, the rationale as to why hospice may or may not cover something, particularly obviously if they don't cover something, because you don't want to be spending money out of pocket, right? Make sure you really understand and know that as you understand what the hospice care provider is educating you on, know that you're still going to have maybe some uncomfortable feelings in your heart. You're going to feel, maybe I'm not doing everything I'm supposed to be doing. I'm so used to doing this. And then, knowing that you're doing something different is okay. It's okay to be uncomfortable there because it's something different. You're not used to it. And you feel like, oh my gosh, I might be missing something. I might be missing the boat here. Know that that's going to happen and that can still exist through its entirety. That dissonance is normal. It's okay. The more you continue to educate yourself, the more we continue to try to prepare ourselves, and you have these conversations with your loved ones, your medical providers, etc., the better it's going to be, the less painful it'll be. This is why we do this. There are many probably other things that, we can get into in terms of real specifics here, but in terms of what's covered, not covered. And this was really focused on what was not covered by hospice or may not be covered by hospice. Again, it's individual case-by-case scenario. Generalities, though, is what I covered here. If there's a specific question, feel free to ask me. But, if you're working with a hospice provider, just ask them for clarification, ask them for understanding and education. If you need something in writing, have them say, is there something you can provide me in writing so I can maybe read it later because I maybe can't process it right now. That's okay too. Let me know your questions, comments in the comments section. I read every single one. I just want to be helpful here to you because you all deserve to die better at end of life and live a great life until you get there. You really deserve that. But part of a great life is death, because death brings that urgency in, right? And it brings the moments in. So this is why we talk about it too. So anyway, I love you all. Thank you so much for watching. If you watched this far, I hope you gleaned some valuable tidbits from this, and we'll talk soon.